Welcome, everyone. I'm Dr. Sheila Segerson, veterinary behaviorist and the Director of Community Solutions at Maddie's Fund. Welcome to Maddie's Monthly Behavior Connection, a monthly webcast where we learn about topics of interest to all of us who are interested in animal behavior, providing support to keep pets in homes, or supporting pets while in the shelter or foster care. Our guest today is Dr. Lisa Radosta. Dr. Radosta graduated from the University of Florida College of Veterinary Medicine in 2000 and completed a residency in behavioral medicine at the University of Pennsylvania. She is a world-renowned industry-leading board-certified veterinary behaviorist.
Oh, good.
You
Dang.
are. She's a former owner of Florida Veterinary Behavior Service and now a consultant, sought after national and international speaker, and a co-author of several books, including Behavior Problems of the Dog and Cat, a great book. The fourth edition is out, and also the book From Fearful to Fear-Free, among others. She has published research and review articles in veterinary and behavior journals, as well as being interviewed for many publications and appearing on multiple television shows. We're very lucky to have her here today. If you're interested in learning more about veterinary behavior, be sure to follow her Instagram account, which I believe is at Dr. Lisa Radosta.
Yep.
Today, Dr. Radosta will be talking to us about Paws and Peace, easing noise fear in dogs and cats. Welcome, Dr. Radosta. I'll turn it over to you and you can start sharing your screen.
Thank you. All right, team. You should be able to see the primary slide, right?
Looks great.
Um, awesome. Awesome. So definitely, as you think of your questions, please do stick them in that Q&A because we should have time for questions. And I think that a little discussion is always a good thing, right? Thinking differently. So let's go ahead and just jump right in. Shelter dogs are in unique situations, like duh, but they really are regarding noise phobia in quite unique situations. And for this reason, like if you go and do a literature search, which no matter how many times I've lectured on the subject, before I lecture, I go back and do another lit search, like what did I miss? What's new, right? What article haven't I included? There's a lot of information on how noise affects dogs, ambient noise like barking in the kennels and electronic noises and squeaking of the cage doors. But there isn't information on exactly noise phobia and how to treat it in those dogs. And that is a challenge for us today. It's a challenge for me. I was just talking to Dr. Segerson about that I consult with Humane Society of Treasure Coast. It's a challenge when I go there. How can I zero in on these dogs that have this specific thing when they're in an environment that is really different? And there are some barriers to understanding noise phobia in particular in shelter dogs specifically. So these dogs are exposed to sounds throughout the day, right? And they might be pretty high levels. Like some of the studies point to 100 decibels. That is really loud. Like I did a noise phobia study. I tested a CBD product and we used 64 decibels and it was loud. 100 decibels is pretty dang loud. So sometimes the dogs are exposed to these throughout the day. And some of the people that are on this webinar are at really nice, well-funded shelters. And I happen to be a part of a community that supports exactly that kind of shelter. It's called the Humane Society of the Treasure Coast. It's just beautiful and they're forward thinking. And then nearby is our local animal control and they struggle. Right. So depending on where you are, you may have a lot of resources to keep it quiet, or you might not have a lot of resources. There's variation in caretakers and in caretaker skill set. In the shelters in my area, we use a lot of volunteers. And the problem is the volunteers are not well trained. And they're not trained to look at a dog and know if the dog is fearful, stressed, anxious, excited. And by the way, that isn't always easy, even if you're not a volunteer, even if you are a team member. It takes a lot of skill to really read body language very, very well. Okay. So there's that. And also we know, at least in cats for sure, I suspect in dogs too, I just have a study in cats that shows it, that variation in caretakers or schedule will cause physiologic stress, right? Dogs are social creatures. They want a family, right? They want someone that they can kind of count on, if that makes sense. All right. So then there's this thing called generalization. And this is really, really important. And we're going to talk more about it later. Okay. Not only do dogs get generalized anxiety, but they also get generalization of fear. So when we're talking about fear, anxiety, and stress, what are we really talking about? I want you to understand the physiologic stress response so that you can understand whether it's noise phobia or aggression or overexcitability. It doesn't matter. This stress response is kind of the same no matter what. There might be little tweaks, but it's pretty much this. So when you see a dog that's jumping too much at the front of the kennel, who's barking a lot, who's hiding in the corner, and you're trying to say, is that dog afraid of me? Is it storm? Is it a sound? Is it the leash? I don't know. This is what's going on inside the dog, right? So there's input to this part of the brain called the hypothalamus, and this part of the brain gets input from like all the other areas of the central nervous system. Okay, so just think of it as like this clearinghouse of input, what you see, what you hear, what you feel, all that stuff, right? And then it tells the pituitary, this other part of the brain, you better release some hormones. You better do something because I'm getting bombarded over here and it's a lot. Okay. So then those hormones say, let's make more hormones. Let's cause some changes inside the body. Let's get some blood glucose going through the veins so that we can fuel all of the different body processes that come with being stressed out. And this is happening whether the dog you are seeing is in the corner, paralyzed with fear, or lunging at the front of the cage. Eventually, all of these parts of the brain get recruited. The amygdala, which is emotional thought, hippocampus, learning and memory. That's why these emotional memories are so hard and you really can't erase them once they're laid down. The LC is this place, the locus coeruleus is this place that kind of tells the body to start moving. You should do something. Here's the thing that you need to start doing: running, fighting, trying to escape, whatever that is. So all of these things happen, okay? You see all these things on my screen? In a nanosecond, these things can happen. And when they happen again and again and again, which they probably are in shelter dogs, in most shelters, when we say the word shelter, it means so many different things. So we're talking in generalities, right? In most shelters, a lot of our dogs are suffering from chronic stress. And the reason I want you to know this is because I want you to understand how hard it is to find noise phobia in these dogs and why, when I tell you how to treat it, I'm going in that direction. Okay. So think of chronic stress as water kind of in a bucket, right? So the water is your stress level. When your stress level is low, and this applies to dogs too, okay? When their stress level is low and they're relaxed, the water is below the top of the bucket. When they're able to cope, water is below the top of the bucket. When the water starts to overflow, that is distress, right? The quality of life changes, welfare changes. So what can we do? What can occur in a dog's environment or life that helps them to stay low, below the distress and then the able to cope and relax zones? Coping skills, which most of our shelter dogs don't have. And maybe you have an amazing behavior department and your shelter dogs have a lot of coping skills. I hope they do. Not every shelter has those resources. Okay. Good health. Again, we hope that we're supplying that to our shelter dogs. We certainly have amazing shelter vets now. But good health is emotional health and physical health. It's both. And also things to do, right? Like stuff to do. Maybe it's playing with other dogs. Maybe it's a food toy. Maybe it's taking a walk. Maybe it's being petted. Stuff to do that enriches that dog's life. I've tried to drop that word enrichment because what I didn't realize, because I would have put it on this slide generally, what I didn't realize, at least what I'm finding out from the followers that I have on Instagram, is that enrichment is a word that doesn't mean anything to them. It's kind of nonsensical. So I try to say, give them something to do, right? So what are all the things that contribute to distress, to making the bucket overflow, and then we would be deeming that dog under chronic stress? Environmental sounds. Many of our shelter dogs are under that kind of stress every single day. Their ears are much more sensitive than ours to these sounds. Inconsistent caregivers, relinquishment, just the fact of being relinquished is stressful. These are social animals. So what I'm doing here is trying to make my case for the chronic stress dogs are under when they're in shelter situations, which I think you probably already know, but it's going to go to the way that we treat and medicate if we can really understand that physiologically dogs are under this chronic level of stress. So then there's this thing called fear generalization. It happens in humans and rats and dogs and all mammals and probably in avian species. We just don't have proof of that just yet. There probably isn't a species where this doesn't happen, I would say, but let's go with what we know, which is going to be mammals at this point, right? So generalization is something that some of you guys had mentioned, you are part of the behavior team at your shelter. You know what generalization is. When we teach a behavior like sit, okay, we want our dog that we're training to generalize. If I teach sit in one room, I still want the dog to understand that outside sit means sit, that in the hallway, wherever I am, that word means the same thing. And if they take that same action, I'm going to reinforce that same behavior, right? That's generalization. That's what it is. But the problem is that when dogs generalize with fear, then they begin to project forward. And this happens with noise phobia. So let's say that you have a dog who is afraid of a sound. Whatever stimuli is in that environment can become a part of the trigger for the stress response. And then it just looks generalized. Just looks like the dog is stressed out, right? But you don't know that the dog's afraid of noises because that original stimulus is paired with this other stuff. And I put a little yellow square around the parts of the brain that are involved, and they're the usual suspects: emotional learning, amygdala, okay, hippocampus, memory, and this other thing called the dorsal raphe nucleus. Why am I talking to you about this? Because once you know how the brain works and the body works, in a practical and straightforward way, you can apply it to any animal you work with. You'll recognize it and you'll remember it. So one more of these sciencey slides I really think are important for you to see. And when I read this study, I was just so excited, right? So when animals generalize fear, so we know, those of you that are in behavior communities or you are part of the behavior team at the shelter, you know what generalization is. We just said, hey, fear can be generalized, just like any other behavior. But what you see on your screen, to me, was mind-blowing, that when fear becomes generalized, the neurons in the brain that secrete certain neurotransmitters flip, and they actually change, right? So if anybody ever tells you that behavior is just behavior, it's not medicine, you know they're wrong, right? Stuff happens in the brain. Different neurotransmitters are secreted once that fear is generalized. There's a change in the brain. And that's why we say that trauma can't be erased, right? Because there are neurochemical changes that I can't make go away. So here's just an example. You've got a lovely dog in a lovely shelter environment, but the dog is afraid of some sound. It's clippers, it's the barking of the other dogs, it's the cleaning tools, whatever it is, it's the hose to spray out kennels. Whatever it is, the dog's afraid of it. So that sound is paired with everything in the shelter environment. And what you see on the outside are pretty non-specific signs. So it could be a dog who's refusing to walk down the hallway, walk on leash, walk outside, or a dog who's aggressive. And you might say, oh, he won't walk down the hallway. He must be upset because, like in one of the shelters that I work in, that I consult with, as we walk down the hallway, that everybody's barking. And we could easily say it's about that, but it doesn't have to be about that. That dog could be phobic of any other thing and now has generalized. Okay. All right. So chronic stress and generalization make noise phobia hard to catch in shelter dogs. So if we don't have like studies that have looked at this again and again, and we can't pinpoint it, what the heck are we supposed to do to help these dogs, right? Well, first, let's turn back to what we know about pet dogs, because noise phobia has been studied and studied and studied again in pet dogs, right? There are drugs licensed, FDA approved rather, like Cilio, for this purpose. Okay, so what we know about pet dogs is literally any sound, from kids playing to construction sounds, tools, airplanes, motorcycles, the usual suspects of light, of thunder and fireworks, the ding of a cell phone, it all can be scary. And I put a bird there, not only because I have lots of patients who are afraid of the birds in the house, usually parrots of some sort, but in Florida, really started with Hurricane Andrew when parrot jungle was just obliterated. We have a lot of exotic species that don't belong here. They're beautiful. A lot of citizens, big birds like macaws, Amazons, who are just flying loose, especially in Miami-Dade County, and they can be loud. And we know that fear is in the eye of the beholder, so any sound. Other things that we know about noise phobia in dogs is that dogs grow into it, not out of it. So that means that this is just one study. This is a survey study, but there is another study that I didn't include here. It's kind of not where we're going to stick. We're going to move forward to treatment, but there's another study that shows the same thing. As dogs get older, their noise aversion, noise phobia, like whatever you want to call it, gets worse, not better. Okay. So we know that if we see signs of noise phobia in pet dogs or stress in shelter dogs, we need to act. Okay. We also know that noise phobia, well, let me just say this, the signs of noise phobia, and be clear, that we would see externally of fear can be tied to pain. So what this study showed us was that when animals are painful, specifically from orthopedic disease, they presented to the veterinary behaviorist for noise phobia at an older age. So they took these groups of dogs that were presented for noise phobia, okay? And they examined those groups to see, well, you guys were presented older, you guys were presented younger, you have orthopedic pain, you don't, what's going on here? And so the finding was dogs who had orthopedic pain and noise phobia presented later in life. So why is that important to you? It's important to you because I want you, especially in a shelter, to understand the threshold theory of behavior change. I made that up, but I've used it for a while and I think it makes sense. Instead of behavior problems, I try to think about behavior change from baseline or homeostasis or the Goldilocks zone. And it occurs on a threshold. And what increases the threshold, so less behavior change, it's wellness, physical and emotional wellness. So even if you are emotionally unwell, if your physical health is really high, then you may have a pretty high threshold for showing signs of noise phobia. But if the dog has pain and fear, that threshold becomes lower for showing those signs. Okay. So again, back to pet dogs. You guys know these signs, I think, but just in case there are people here who have not experienced this or treated a dog with noise phobia, this is a video that just has kind of a group of different signs.
No, Lexi, come here. Going into the little house. Rex, Rexy, come here. Come here, boy.
Storm. After storm, Sadie pacing around. She's also drooling. She also defecated in the house several times, but this is
Okay, so again, I'm going to repeat myself, but it's going to be hard in most of the shelters that I've been in, I guess, to be able to identify that singular event that is stressing that dog and know if it is the sound, the sight, the smell of that stimulus or a group of stimuli. So what can we do? That's why we're here, right? Number one, as shelter veterinarians, we need to treat pain and discomfort, and we need to be aggressive about it. We can't be judging only on whether or not the dog is limping. We need to look at nail wear, muscle asymmetry, whether or not the dog wants to walk, maybe get videos as our handlers are walking the dog from the side and up and back, just so we can assess for pain. When in doubt, do pain trials. And in my clinical experience, a pain trial has to be 21 days. I used to think it could be 7 or 14. I just don't think it's long enough for us to see subtle signs of pain, even though the pain relievers that we use work pretty quickly, right? So 21 days of an NSAID of your choice will work, but we want to treat pain and discomfort. And don't forget, discomfort is also itchiness and GI distress, okay? Keep dogs busy and occupied as much as we can. Depends on our budget, depends on the layout of the shelter, depends on how many volunteers we have. It's a lot of things. However, if we can keep dogs busy and occupied with food toys, puzzle toys, play with other dogs when appropriate, then we will have a better chance of reducing chronic stress and seeing what we're left with. Maybe we could identify what exactly had scared the dog in the first place. Use validated tools for assessing coping ability. Okay. These are not temperament tests. A colleague of Dr. Segerson's and mine, her name is Dr. Megan Herron. She works at Gigi's, which is in Ohio. It's a shelter. And Megan, Dr. Herron, is working on a tool that she will publish, no doubt. She's already gone through 2 phases to validate this tool. It's a specific type of questionnaire that shelter team members fill out. And what she's looking at, instead of looking at temperament, she's looking at coping ability. Is the dog coping? And once you use a validated tool like that, you will know when to prescribe and how to prescribe. So I think that's going to be really important. And what dogs have to be moved from the shelter into foster right now, and what dogs maybe can wait because they're coping well. Create safe havens. We know this is important for cats. It's important for dogs too, to have a place where they can hide away from everything. This can be a real challenge in shelters because of the sound, because of our need to keep things clean, to reduce transmission of disease. There's a lot of reasons why we don't do this, but having a safe place for dogs to go is really important. We can decrease environmental sounds as much as possible, whether that means playing music that might help to drown out other sounds that are scary, or whether it means moving dogs who bark a lot into different areas of the shelter if we can, or moving those dogs into foster if we can. Using, standardizing our handling and our training. Again, we're using volunteers at the shelter that I'm at most frequently, and it's really hard to do that. But even if we can standardize the way that we care for the animals and give them a schedule, even that is helpful to reduce chronic stress. And now we get to the things that the shelters in my area are really starting to utilize these things. And we're going to talk more about these in a couple of slides. Short-term medication for events or for when the animals enter the shelter in the first place, and daily supplements or medications when dogs enter the shelter for the long term. So we're going to talk about that in a minute. Okay. We talked about these things already, so I won't go through them again, but basically we want to try to make that environment as safe as we can for these animals so that we can reduce chronic stress. If we don't reduce chronic stress, we will use more medicine than we probably want to or need to, okay? Because we're fighting that stress response that I showed you, right, many slides ago. All right, so what are the best practices for prescribing in the shelter? Because it looks a little different than when I walk into an exam room and I prescribe for one of my patients, right? Just a reminder that this is what you're prescribing for. So if you are a veterinarian or a behavior consultant, you might be in the mindset of make a diagnosis or come up with a why. This is the why. It's noise, it's separation, it's fear of people, whatever. I'm not going to encourage you to do that. And I actually don't encourage primary care practitioners to do it either. I encourage them to look at this slide and understand what they're medicating for. No matter what the problem is, you're medicating for this. You're medicating for a stress response. We have to get ahead of it. We have to medicate so that we can push it down so that the animal can cope. All right, let me just text my husband because the ding that you're hearing is his computer. There it is again. There's the ding. Anyway.
I was like, is that my background that's dinging? It's you.
No, it's my family. So before but he was not here when I started, and I went to his iPad and I put it on Do Not Disturb, but he's got his computer hooked up, and I guess he gets 1,000 texts a day. Okay, so I'll tell him, turn off your notifications. Okay, perfect. Now, this is my belief. This is my belief, and some of you are going to be like, really? It's my belief that most dogs should be started on a medication or supplement when they walk into the shelter. All right, hear me out if you're on the other side of this, okay? So here's my argument. Being in a shelter is stressful. We don't know which animals are going to implode and which animals are not going to implode. We don't know what animals are noise phobic. We know, oh my God, it might have been Sheila's study. We know from one study that people lie if they think something might happen to their dog. They lie upon relinquishment. If they think that what they're saying, the negativity of what they're saying is going to affect what happens to their dog. So we're not getting complete truths necessarily from all people who relinquish. So if their dog is thunderstorm phobic, for example, they may not be sharing that with us. There's a good chance they won't be sharing it with us. We won't be able to figure out what the dog's afraid of because the dog's in a shelter and he's suffering from chronic stress. So in my mind, what I would rather, unless your shelter is intake and off to foster, is that dogs go on drugs immediately. I know that might be controversial, but that is where my mind is. We also can dose for events in the shelter. Of course we can. And the drugs that are on this screen are just drugs that you see used a lot and that most of us have available to us. The shelters that I work with do not have controlled drugs. Some of them, the doctors can write prescriptions to outside pharmacies, but most of them cannot. So you may not have access to alprazolam, which is Xanax, but most of the shelters that I work with have gabapentin and trazodone, and now more and more are having clonidine like on their shelf that they can dispense, okay? And the way that you are going to prescribe these drugs depends on the clinical signs of that particular dog. There is not an answer, a medium-sized Malinois always gets this drug. Not like that. It's more what the dog looks like, okay? So alprazolam, if you have access to controlled substances, alprazolam brings dogs out of their shell, okay? It obliterates fear. You should know the side effects of these meds for sure before you start a dog on them. That's a given, of course. It obliterates fear. It increases appetite, very short acting. Trazodone can be quite long acting. In some dogs, it'll take 24 hours for them to metabolize it. It is more likely to make dogs quiet and calm, which, if you're going into a really scary and stressful situation, that might be a good thing. And as most of you know, there is one study looking at the administration of trazodone initially upon receipt of the dog, relinquishment of the dog into the shelter. So that study showed an effect on adoption. You could criticize that study. You could criticize any study. I promise you, you could tear up any study. Believe me. What I can tell you is that I think that study's promising. And of course, there need to be more studies. Gabapentin is in our hands, the hands of veterinary behaviorists and behavior professionals, is used for anxiety. Okay, it's also an anticonvulsant and a weak pain reliever, but that's not where we're using it, right? We're using it for anxiety and it does a pretty good job of that without a lot of sedation. Okay, know your side effects, of course, because every dog is different about the way they're going to respond. And then there's clonidine. Clonidine is an alpha-2 agonist. It pushes down what I showed you in that slide. It pushes this down, pushes it down, okay? So that it's not as prominent. And at higher doses, of course, it can be sedating. So if I bring a dog into the shelter and I want to put him on something that day, I need something that works that day. We call those PRN meds or short-acting meds. I can't put him on Prozac that day. I could, but it's going to take 6 weeks to work. And I'd really like him to be out of the shelter before 6 weeks. Okay. So I'm going to think about that med as a as needed med and as we would like as a typical veterinary medicine. But when a dog comes into the shelter, my preference, again, can be controversial, but my preference would be the dogs get medicated in such a way, let's say gabapentin, where they would get it 3 times a day, if that's possible with staffing, trazodone twice a day or 3 times a day. So we cover the dog for those first couple days and he never mounts that giant stress response. Okay. We always start low and we go up. By week 2, if the dog is still with us, then we're probably increasing. We might even be trying other medications. And then we may send dogs home on these medications, which I will tell you, my gut, like as a human being, I want to say dogs on medications don't get adopted. I would love to hear what all of you guys have to say, what Dr. Segerson has to say. But I've had the joy of working with some amazing rescues over the past 17 years of owning my practice, like really good rescues. Those dogs are medicated. They get adopted. They don't have any problem at all getting dogs adopted out. And I have friends working at shelters around the country that have told me the same. So my gut in this instance is probably wrong. And when I was talking to the CEO of a shelter yesterday, I had a meeting with him. We actually talked about that. And he said, we can't send dogs home on the medication. And I said, why? Why can't you send them home? Like, if it's helping them, why can't you send them home? I think the challenge we have is that people take dogs off their drugs as soon as they get home. We have to somehow help them to understand not to do that, but I digress. Acepromazine. Acepromazine is not a horrible medicine. It's not. And I think the word is getting out, but I also hear, at least from my pet parents and the dog training professionals that I work with, that there's still some negativity around acepromazine. It can be a really lovely medication for what it's good for. It's good for calming dogs down. It's not an anxiety reliever. No, it isn't. But it can calm dogs, and I use it sometimes at excruciatingly low doses. That is half of the bottom of the published dosing range. And it can be really effective in helping dogs cope. Do not throw this medicine away. And by the way, if you had seen me lecture a decade ago, I would have said to you that you shouldn't give acepromazine to noise phobic dogs because it increases noise sensitivity. And I'm ashamed to say I have yet to find a reference that proves that. Like, where's the reference? Where's the study that proves that? And yes, I do administer acepromazine to noise phobic dogs sometimes, because guess what? It might be the only thing that helps. Do I ever use it by itself? No. But do I avoid it like the plague? No, I don't. I actually have several storm phobic patients that are on an antidepressant and on another maintenance medicine like pregabalin or gabapentin, and I add in little acepromazine for storms, and it helps them to sleep. And because the dose is so low, they don't have that ataxia that people really get upset about when their pets are on acepromazine. Do not shy away from this medicine. Just use it correctly with the right intention. Benzodiazepines, this is Valium, Xanax, Ativan. And again, some of my shelter doctors have access to these drugs and some cannot write prescriptions for outside pharmacies and don't keep these in their in the shelter. Okay, so here's the thing: there's no way to predict which benzodiazepine is going to be right for any particular patient. There just isn't, right? So what we do in the practice and what we do in shelters is the same. We basically just try different medicines. And if we try at least 2 or sometimes 3 benzodiazepines and the dog has side effects, we usually will abandon that drug class. But because the benzodiazepines are so unique, how they work and whether or not the dog has side effects is so unique to that particular dog, we do try again and again and again within that same drug class. Okay, so what if I have a dog who's going to be with me for a while? And that was something that the CEO of the shelter that I met with yesterday and I discussed, like, what do we do with these lifers? They're going to be with us for a while. They're hard to adopt out. They are not coping. These dogs really need something that might take a little longer to work. And when I say longer, I say 4 to 6 weeks. Okay, so they're really not lifers. If they're staying with us for a couple months, this is something that we need to consider. So what do we do for those dogs? And when do we make that decision? So that decision, I think, needs to be made early and often. I can't imagine going from a home with my family to living in a shelter. I can't imagine it. And sometimes when I lectured at a shelter nearby where I train their team for them, so I was lecturing, and whenever we talk about meds, we get a lot of questions, a lot, because this team, they care and they want these dogs and cats to leave healthy, emotionally well, and they want those adoptions to stick. And they were really concerned that by medicating the dog, I was kind of altering the product that they were selling. In other words, the pet parent might get that dog home and be like, oh, off the drugs, it's a totally different dog. And this is not the dog I wanted. That has not been my experience. However, what I will say is that the dog that that person adopts in the shelter is not the dog they're going to have in 3 months, whether or not that dog is on medicine, because the shelter is an artificial environment. So I'd like to see us starting to choose things that probably do bring that dog closer to his normal baseline. That when he gets into a home, he's not having to take 3 or 4 months to adapt. Okay, so pheromones are an excellent way to, cause no side effects and potentially really help to lower the animal's stress level. There's different kinds now. There's not just Adaptil anymore. There's also Zenny Dog. I'm not a collar person. Because I just don't like things around dogs' necks if dogs are going to be in any sort of cage. But the diffusers from Zenny Dog do not plug in, which is fantastic. They kind of wear down like a gel, so they can be placed anywhere. So I love those. And if you don't have a big budget, maybe your shelter CEO or director can reach out to Verbac and see if they will donate them to you or sell them to you really, really cheap, like BOGO, so you can use them in your shelter and be able to afford them. Okay, what about L-theanine? So L-theanine is in several different supplements, and you see them here. There are other ones too. It is a very commonly used ingredient, and it is a glutamate antagonist. Okay, so glutamate is this neurotransmitter that is ubiquitous, is all over the brains of dogs. GABA is also all over the brains of dogs, right? And glutamate acts as the gas on the system. It's like a little turbojet. And when you give this particular amino acid, it slows the system down by blocking that turbojet. Okay. Now, you might be looking at this and going, but wait a minute, I've tried these and they haven't worked. Here's the number one reason in my experience why they don't work, besides that they might not work for that dog, right? But the number one reason that they don't work is that they're used at the wrong dose or the wrong dosing frequency. So you can see my doses at the bottom left-hand corner, and I'd start at 5 milligrams per kilo twice a day for 7 days, and then I increased to 10 milligrams per kilo for at least 4 weeks. If at that time you don't see at least a 25% change, feel free to discontinue. Now, these products also have other stuff mixed in. So Soliquin doesn't have just L-theanine. I still dose it based on the amount of L-theanine. Okay? So here's the other thing that I want you to know. You might be looking at these and going, are you serious? We cannot afford to give these products to shelter dogs. Okay, no problem. Easy peasy. I want you to get the L-theanine branded product. Okay, so if you flip these boxes and bags over, they use sun theanine, S-U-N, like the sun. So if you are not going to use a branded product, which if you can get it donated, if you can get it funded, you should because of the quality of the product. If you can't, use sun theanine, okay, at this dose. This is, and I'll show you in a minute, actually, the kind of cases I would choose for this. But what I want you to know is this slows the anxiety down. Zilkine is another one that you can give that we have some evidence actually at high doses. It'll work within about 3 days, which is nice. And otherwise, it's probably going to take about a month. And you can see my doses there at the bottom. Again, I think a lot of failure comes from not using the right dose and for the right amount of time. So how do I make choices? Zilkine works at the same receptor, the GABA A receptor, so the same receptor as those benzodiazepines like Xanax that obliterate fear. So I'm going to give this dog alpha-casozepine. I want to obliterate fear. I could start it day one when the dog walks into my shelter. The likelihood of side effects is like near zero. Okay, day one. And if you think you're pressed for time, just start at 30 mg per kilo. Don't start at 15, right? That way you'll get the maximum effect. I'm going to give this Chihuahua these supplements. So in the dog where I'm seeing that part of his coping, skills or his coping toolbox is aggression, I'm going to choose an L-theanine supplement or that sun theanine. Okay. Many of the dogs that we anticipate are going to be at my local shelter for a long time go on some sort of antidepressant. Which one you choose, I mean, look, we could talk about this alone for an hour, just how to choose an antidepressant, but I'm going to give you some kind of guidelines. Dogs that come in sad, afraid, aggressive, right, as a part of their coping toolbox, we're going to look to either reconcile, which is fluoxetine is what we most often use in the shelter. We usually don't use the brand. I wish that we could and would, but sometimes cost is prohibitive for us. So, or something in that category, Zoloft, Paxil, right? If I have this dog, and you know who this dog is, the Looney Tunes dog, who may not necessarily be aggressive, or maybe you don't think he's fearful, but the way that he shows back to this, this is what you're medicating for. The way he shows how upset he is to fidget. It's very easy to look at a fidgeter and think they're okay. Very easy to think they're excited when in fact they're freaking out. Those dogs I target with Clomicalm. Clomicalm is a tricyclic antidepressant. Okay. It is by nature what the drug is. It's an antihistamine. So it quiets dogs almost immediately. And we have used this acutely, but honestly, it's really not the best way to use it. So I reserve this medication for those dogs who are exuberantly anxious or out of control. So when I work with my rescues and shelters and we send dogs home who are on medications, because I think you probably got the message that I think a lot of these dogs need to be medicated or on supplements just by the mere fact they're in the shelter. The biggest risk factor that I see is these new adopting families think, oh, he needed that for the shelter. Well, of course he did. He was so stressed there. It was so awful. And now he's in my home and I'm a loving pet parent and I have a beautiful, perfect environment for this dog and he doesn't need the drugs. So they stop the drugs. Well, so that can have really negative outcomes because you know the rule, 3 days, 3 weeks, 3 months. It usually takes about 3 months for the dog to get adjusted. So I usually ask people to just continue with the meds for 3 months unless they start to see side effects. So in other words, like let's say at the shelter, I had to have a dog on Clomicalm, 2 mg per kg BID, so that he could live a relatively normal life. When he gets into a home, and let's say he really does love that home, he's like, ah, perfect match for me. He might look sedated. He might, because he doesn't have that arousal all the time. So he doesn't need that much drug or maybe that drug at all. But what I want them to do is reach back out to us. So we usually try to transfer care and I try to stay, if I can, involved in some way, even if just my team is a touch point, so that people can reach out and say, you know what, he's a little sleepy. Then we'll obviously tell them to lower the drug, but even then, I won't completely take the dog off until I've been through a couple months transition. Environmentally, we want them to be aware that their dog could have noise phobia. So again, we got to make blanket statements because we cannot identify directly in every single one of these dogs what they're afraid of. So what I try to tell everybody, matter of fact, I just did a series of videos for a website, a company for their website, talking about just this. Every dog should have a safe place. Every dog should have a place. And you can see my dog there. He's passed on. That's why he's also behind me in that picture. But there he is in my closet, right? Every dog needs a safe place, and that goes against what pet parents believe. They want the bed in the living room. Have a bed in the living room and have a bed in another room too, or in your walk-in closet or in a half bath or wherever, right? So we want to set that room up. We want to have classical music there. That way we are creating a safe space for the dog before the dog becomes hyper attached to the pet parent and only feels safe with the pet parent. If the dog ends up like 50% of the dogs in the US, yes, 50%, and has noise phobia, we are protecting against that, okay? And what I want you to know is that at least in one study, just these changes alone, environmental changes, helped 70% of the dogs to cope with noise phobia. So we should be recommending these safe places. And believe me, people are not doing it. And by the time they come to see me, and by the time they go to see dog training professionals and we're recommending it, the dog is so hyper attached to them that the dog doesn't feel safe in another space. Okay. Feeding, treats, food toys. We don't know if this dog's going to turn out to be noise phobic. However, we can say, if you see your dog getting scared, do these things. We can up front tackle the question you know they will have. But if I feed my dog when my dog is scared, aren't I reinforcing the fear? We can tackle it right up front. No, you are not. You cannot make a dog more scared by giving him positive reinforcement. Okay. But you can make it so you're the only place he feels safe if you don't create a safe space where you can put a food toy, right? So you explain these things to them. Again, these things, 70% effective. Here's a mind-blowing statistic that I love, like to repeat again and again. In one study of noise phobic dogs, the researchers kind of said, here's all the things. Which of these things did you do? Right? So the person checks off. I did this and this and this and this and this. I gave drugs. I did this, that. So then they tried to pair those things with outcomes. Like what if we have, let's say 5 people that did these things. And then let's look at those 5 dogs. Did those dogs get better with time? Did they get worse with time? What happened to those dogs? Well, the only thing of drugs, behavior modification, environmental changes, the only thing that was correlated with decreased fear over time, because remember I told you that dogs grow into noise fear, not out of it. The only thing correlated with decreased fear of sound over time was playing with the dog, giving the dog food during the noise event. People resist this, but this is incredibly effective and dirt cheap to do. You can do this in the shelter. They should be doing it in their homes. Let's give people really good science-based education on what to do when their dog is scared. Storms, fireworks, any sound, any situation. They're told again and again, and 15 years ago, I said this, right? Ignore your dog when your dog is having a panic attack. Now, I can't believe I would ever say that, but you live and learn, okay? Fear cannot increase through positive reinforcement. And another study showed that the behavior of the pet parent, they could stand on their head, they could give positive reinforcement, they could ignore their dog, doesn't really have a significant effect on the behavior of the dog during noise events. So I tell people, I say, hey, if your dog's having a panic attack, don't be a jerk. Hug your dog, pet your dog. Understand that if you do nothing else than that, you are teaching your dog that there's only one safe place and that's next to you. And I'm not sure you want to do that because you better not try to leave the house when there's a noise event because your dog won't feel safe, right? So get your safe zone prepared. Give your dog a food toy. Play fetch with your dog. Play tug. Do whatever you need to do in order to help your dog kind of turn the corner of doing something fun during that time and not just being next to you. Okay, now that you know kind of my perspective on how I treat almost any phobia in a shelter situation and what we can tell people at home, let me know via the Q&A, or it looks like some people are posting in the chat too, so I'm sure Dr. Segerson's checking that out. Will these techniques work in your shelter? Why won't they work in your shelter, right? What ways are you personally going to try to advocate for dogs who are noise phobic or under chronic stress in your shelter? What needs to change in your shelter in order for these strategies to work? What do you need to overcome? So we have time. So let's talk about this stuff.
Great. Thank you so much, Lisa. This was super, super interesting and helpful information. We certainly have some questions that we'll get to, and hopefully we'll get some new questions and or comments in regarding what you have up on the screen. If you could stop screen sharing though, now that we're in the Q&A part so that people can see you better, that would be great. Our first question is, what would you say to someone who would be worried about the stress supporting drugs being considered as tampering with the dog's personality as false advertising of the animal's behavior to adoption? This is the number one question I get usually.
Yeah, that's what I said during my webinar, right? Is when I was lecturing to the team at the Humane Society of Treasure Coast not that long ago, my local Humane Society that I'm involved in. These were the questions. This is what they kept asking me. So I think this comes from a place of, I really want this dog to be in its forever home. I don't want this dog returned, because they thought they were getting one dog and instead they're living with another dog. So here's what I say. Number one, half your neighborhood is on these drugs. Okay. They're not zombies. They're living their lives. They're going to work. They have partners. They have friends. They have kids. These drugs do not completely change the animal's personality unless it doesn't suit that animal or is prescribed in a way that's not correct for that animal. And that's the reality of medicine. Any medicine can alter personality. All right. So that's number one. What are we really doing? We're really doing is quieting a body that is in distress and the physiology of the stress response. So that's number one. You're not changing the personality in a negative way. You are changing the personality in a way that helps the animal cope. Number two, you have to be upfront with people. You have to tell them, obviously, what medicine a dog is on, and we tell them our plan to get the dog off. Like, we don't say, have a nice day, take these drugs. We say, all right, our plan is for you to keep your dog on for 90 days. And if you feel that you're seeing weird stuff or you want to take your dog off, we're just asking you to call us first and speak to a technician or someone in the behavior department. Just let us know and let us guide you as to what to do. Because sometimes people will say, my dog's not eating, it might be the drug, and the dog's sick. It has nothing to do with the drug, right? So I think that a good handout can also be really helpful. Or what I'm working toward with my local shelter is education of the people who pick up the phone and making sure that when dogs are adopted out, that we are supporting them as best we can. But I think, if you, let's say, I've been married a long time, yesterday, 25 years, and I dated the same man for 7.5 years. So I don't know what the apps are now for dating, but here's my analogy. Let's say you're on the dating app, whatever, I don't know what the heck it is. And you find this lovely person and you go out with them for 3 weeks and you're like, this could be it. This could be my partner for life. And then you find out after 3 weeks, oh, wait, she's on Prozac? Are you thinking she's damaged goods? Are you thinking you can't have a relationship with her? Are you going to just discard her? No. What you see is a person who's well-adjusted and happy, partially because of the medicine, right? So hopefully that helps a little bit.
Thank you, Lisa. That was great. Next, we're going to take a live question. Justin, you can go ahead and unmute yourself if you have a question you want to ask live. If not, you may have raised your hand by accident. It looks like maybe he raised his hand by accident. If you would like to ask your question live, just type in chat, Justin, but we'll move on. Our next question is, let's do a cat one. What about cats? Is there any info about helping cats who are shut down?
Yeah. So, we didn't talk about cats today. It was a conscious decision. Cats get noise phobia, by the way. We know they do. My resident who didn't publish her work, her survey study showed that. And we have a strong suspicion. My own cat has a noise aversion. I wouldn't say phobia, but an aversion. So it happens. So be aware of that, number one. Number two, what do we do if cats are shut down? I think cats, my God, more than dogs, They need drugs when they come in. They really need some help when they come into your shelter. And there've been good studies, and my resident now, she's completed her residency, she's not a resident anymore, is finishing up a study with Dr. Julie Albright regarding gabapentin in shelter cats and looking at just that, giving gabapentin upon entry. And also she is looking at the likelihood of infectious disease being lower in cats that get gabapentin. What we seem to forget for some reason is that the immune response is tied to the emotional response, that the emotional response, and I hate to be like, I'm a dang broken record, but here we go again. This is the emotional response. This is physiologic. And that affects the immune response as well, right? And the spread of infectious disease. So I would like to see cats getting Zilkine or gabapentin as soon as they walk in the door. And maybe one day it will be pregabalin. It's easier to dose. You can give less, it lasts 12 hours. I mean, I'm assuming, and maybe I shouldn't be, but I'm assuming that you are probably doing all of those things in the shelter that we expect you to do for cats, having a cat room, keeping the stress level low, making sure they have hiding spaces, making sure they get exercise outside in the cat room, interacting with other cats if that is appropriate, that kind of thing.
Great, thank you. We have a couple questions about prescribing medications in the shelter environment and budgets and funding. The first one related to that is that I'm going to ask is from Terry from Companion Animal Advocates in New Jersey. And she says, what would you say if a municipal shelter says it does not have resources to give dogs anxiety medications?
Yeah, so there's an animal care control, a municipal facility very close to me. And so I've had those conversations. So what I say is, okay, explain to me what that means, because that means different things to different people. Prozac is literally 2 cents a capsule. So it can't mean just the cost. Trazodone, you can source it pretty dang cheaply. Clonidine, it's like, I don't know, 3 or 4 cents a tablet. It can be sourced very cheaply. So first I try to figure out what problem am I really solving? So I got on the phone with a shelter vet. I did some consults for her. She was up in Chicago and I couldn't understand what the problem was. It's like, what is the problem? Like, these are cheap. What is the problem? And she finally said, I don't feel comfortable. So when someone comes to me and says, I don't have the resources, I try to figure out what challenge am I overcoming? Because some of these drugs are cheap as dirt. They're not controlled. Sometimes it is about the veterinarian's comfort level. Sometimes it's about the vet has read or heard that these drugs cause animals to be aggressive. Sometimes it's about the person at the top of the pyramid, and it's not about the vet at all. It's about the person at the top saying, we're not going to do this. So shelters are complicated, just like any other organization. So that's what I would figure out. But resources money-wise, guys, Prozac, very, very, very cheap. Clonidine, very cheap. Gabapentin, incredibly cheap. You should be able to, that should be affordable. And if I think part of it could be you don't know where you're ordering from, like you don't know where to order it cheaply. So what I would do is reach out to a primary care veterinarian, because your shelter vet, like we all know each other. Your shelter vet can reach out to a primary care and say, where do you order your Prozac? For us, we ordered all of our human drugs from a company called Anda Meds. They're in Miami. But there's another one. There's well, actually now you can buy a lot of them from veterinary suppliers, carry a lot of these drugs. So that would be my answer to that.
Thank you. We're just about out of time, but we have a lot more questions. I'm going to end with Justin's question. I guess he couldn't unmute himself. Question is, what is the best medication to use for dogs who are being destructive in the home? What about dogs who are being reactive on leash, but don't show reactivity elsewhere?
This is a great question, Justin, and I don't have a short answer. Do they cut us off at 4 o'clock? Can I go for a second?
No, you can
Yeah.
go after. And if anybody has to leave, the recording will be accessible.
Got it. Okay. So there isn't an easy answer to that. That's unfortunate. I can tell you about resources. If you've seen me lecture, probably the lectures are still on VetGirl. You can see it there. You can go to my textbook and read one of the chapters on social media, on YouTube. But here's my answer. What I do is I don't look at the I don't look at the diagnosis, right? I try to look at what the dog needs. So I'm going to stick with, let's say, destruction in the home. So what does that dog need? Is the dog destructive in the home when the pet parents are home? That's probably not really a medicine answer. If the dog is destructive in the home when the pet parents aren't home, this is an owned dog now, I'm assuming. Then I'm going to try to figure out when the dog's completely alone, when the dog's in the crate, right? Because a lot of these dogs can't be crated. If we just take them out of the crate, they're perfectly fine, right? So I'll try to figure that out. And then I choose a medicine. If I'm trying to quiet dogs and I need a medicine that works right now to quiet a dog, just sleep for God's sake, that is a trazodonase promazine road, clonidine maybe. If I have a dog that I want to reduce anxiety, I'm probably on the gabapentin, benzodiazepine, pregabalin road, but I got to tell you, that's pretty general what I just said. That's pretty darn general. In reactive dogs, so many dogs are reactive on leash and not off leash and not at the window of the house or whatever. That could be due to noise phobia. Again, we want in that situation to look at what is our outcome? What do we need to do? We need a dog who can walk and not be scared. So that probably rules out promazine and trazodone. Probably we're looking at clonidine, gabapentin, or pregabalin, but honest to God, it really is going to depend on the animal. It's a complex question, but thank you for asking it.
All right. Thank you so much, Dr. Radosta, for joining us today. This has been amazing. We have a number of questions that we weren't able to get to, but we will get those answered on Maddie's Pet Forum, where Dr. Radosta will be available for the next few days to continue the discussion. So feel free to post more questions today. Thank you, Dr. Radosta, and everyone for who's here today. Join us next month, where we'll be hearing from Dr. Valerie Tynes, who will talk to us about separation anxiety in dogs. Thank you all, and we will see you next time.